Cunningham. Mr. Cisneros, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I just want to thank all the witnesses for being here this evening. Dr. Stone and Dr. Franklin, I sat down and had a conversation with the director of the VA Long Beach Medical Center, and he mentioned a pilot program that they're running called the Veterans Medical Evaluation Team, or VMET. Have you heard of it? Yeah. So for those of you who don't know, this program, it's a partnership between the Department of Veterans Affairs in Long Beach and also law enforcement, local law enforcement, to proactively reach military veterans in trouble, even if they're not connected with the VA system. They train local police officers, even a VA clinical technician will even often go with the law enforcement officer on calls when it's regarding a veteran. He touted this as a very successful pilot program that they're running, and we heard about several other examples of successful pilot programs that local VA hospitals are running as well, just here this evening. How is the VA kind of collecting this data from these? I mean, you're encouraging the local VA hospitals to go out and to run community programs, but how is the VA overall collecting this data and then deciding if these pilot programs are successful and then trying to implement them out on a larger scale?
It's a very good question, and I appreciate this example that's happening in your area, because we have 24 cities that are working with us and 7 states. We call them Mayors and Governors Challenge, and they're implementing, just as you described, creative evidence-based approaches that involve training community members and accessing care and reaching veterans where they work, live, and thrive. We bring them in collaboration with our colleagues here from SAMHSA to train them on these approaches so that they can execute these, and we monitor them over time through a technical assistance arm that is offered through my colleague Richard McEwen, who's here today, and we do it together. We host a series of monthly calls with local mayors and governors county teams to learn the best practices, and we've created an online IT platform where we call it a community of practice, where they can also input their best practices and the data into this platform where anybody across the VA can go in, look, share, and learn. And so that's a little bit of how we're doing it. I want to have Dr. McEwen also share, because he's helping us on this effort.
Yes, we are. I think it's a very important initiative, because it's really trying to promote comprehensive approaches to suicide prevention at the local level, which is what we think is really needed. And so we look forward to our continued partnership with the Veterans Administration around this work, both in the cities, in the rural areas, and among states.
So we're sharing best practices, which is great, but has there been any example of a program that taken a program and said, okay, we need to implement this nationwide because it's working?
Yes, I'll give you one example that was actually done under the leadership of Dr. Stone, and that involves our ER work. So there was an initial early study that spoke to the importance of aftercare when people leave our ERs, where they're getting this simple intervention, also mentioned by my NIMH colleague, around caring outreach with a phone call to veterans when they leave the emergency room. And it pointed towards significant reductions in suicide when they have this caring outreach. And we had done it in a pocket, I believe it was 7 of our facilities, and we had tracked the data over time in a small pilot. And when Dr. Stone got in the seat of the executive director, we had a series of meetings and put it on a fast track for full implementation across the entire VA system, every ER. I don't know if that sounds like.
And this is specifically directed at survivors of a suicide attempt. And as was mentioned earlier by our colleagues, they had seen a 30% reduction. We're actually seeing a 50% reduction in future suicide attempts.
Good. Yeah, like you've heard numerous times today, it's basically it's going to take a village. The VA can't do it by itself. Everybody's going to need to get involved, working with local law enforcement, local officials as well, to make this all happen. The last thing I have, just you had mentioned the program that you've been working with the Air Force to kind of, you've been able to work with the Air Force to kind of help minimize their numbers. As the first I heard of this program, I would love to see more information about that. And I would really, if it's being so successful with the Air Force, why haven't we been able to implement it with the other services?
I would not speculate, sir, on the on what the other services have done or not done. I've been out of uniform since 2014. I can tell you that we in VA are incredibly intrigued with the fact that the has taken as far back as 1996 the integration of suicide prevention strategies and integrated them into virtually every level of officer and enlisted training. And in response to 18 years of warfare, they've seen almost no increase in Air Force veterans or Air Force active service members of suicide rates.
Well, my time has expired, but if you can make that program, the information about it available to us, I'd appreciate that. Thank you. Thank you, Mr. Chairman.
Thank you, Mr. Cisneros.